Welcome to Midlife Matters, where we celebrate women's wisdom and wit. I'm Georgian Lussier, your host, and I'm delighted to introduce today's guest, Dee Anderson, the Chief Nursing Officer at the Hospital for Special Care in New Britain, Connecticut. And Dee has advanced degrees and certification in both nursing and education. Welcome, Dee.
Thank you, Georgianne. Thank you for having me.
Oh, I'm delighted. So we're going to learn a lot about the field of nursing and what this particular facility hospital offers. And you've worked at the Hospital for Special Care for about 6 years.
Correct.
Tell the audience a little bit about the hospital because it is such a specialized facility. Many people might be unaware of all that it offers.
I'd be happy to.
Okay.
So, Hospital for Special Care, affectionately known as HSC, is a 228-bed hospital, and it's called an LTAC, which means there's long-term and acute care units. And we offer highly specialized services for patients in the field of ALS, autism, neuromuscular disorders, acquired brain injury, and spinal cord injuries.
And also, I believe, having been involved with HSC myself, is that it's one of the hospitals that serves both children and adults.
That's correct. We have a 28-bed inpatient unit, and we have children that are both acute and chronic. Some have been with us for years and years and have debilitating conditions which exclude them from area nursing homes. And some just have to recuperate from large surgeries, and they are on our short-term side.
The hospital is also distinguished as offering autism services with some inpatient, and that's growing.
That's right. So we started with a grant with 8 beds. Over the course of 2 years, increased our bed size to 10. Because there was a tremendous number of children in the community in emergency rooms and distressed families that needed the services that we provide. We're currently in the process of preparing to break ground on a new autism building, which will be on our campus and will house 12 children. And all the offices of the care providers will be attached, in addition to an outpatient center, which will be a daycare type of a setting. We're very excited to be able to offer.
Is one of the only one in the country?
There are a few inpatient in the country, but we've been receiving referrals from the country. North Carolina, people fly their children in. They fly them home much better. Our outcomes have been most excellent.
And so that's such an important thing for any viewer to just really appreciate that autism being something that affects many, many families. We have a capacity right here in Connecticut to help on that journey. No easy answers and obviously long time effort for the families, but HSC can play an important role in that.
Yes, and we've drawn a lot of caregivers into the arena that are interested in this patient population.
And you started out as a critical care nurse over 30 years ago. Let's start with, what are some of your roles and responsibilities at the Hospital for Special Care, and how did you step into those?
Okay, so I started as an educator in my education. I went through nursing education program, and I was the director of education at Sharon Hospital, the northwest corner of Connecticut. And I was recruited as an educator to Hospital for Special Care. I wasn't really looking for a job. I kind of surprised myself that I liked the area so much, and I've been there 6 years as the director of education. And in my current role, I am overseeing the 228-bed inpatient facility, which includes 11 long-term and acute care units, 25 nursing leaders, which includes managers, clinical effectiveness leaders, educators, wound care specialists, case managers, discharge planners, and a lot of wonderful bedside staff.
And so you have about how many people reporting?
Probably about 550.
Okay, so that's the majority of the hospital, I would imagine.
It's more than half. Yeah.
So that's a huge clinical role.
It's a wonderful role.
Yeah.
Yes.
And you've been doing that for a little over a year?
A little over a year, and the experience I had as an educator is directly applicable to this position, and it's really enhanced my ability to perform my job.
And I know there's a lot of advancements. Let's talk about some of the things that have changed over the years since you first started being a nurse 30 years ago.
Absolutely. I've seen amazing changes in healthcare. I think the most impressive is in technology. We have now remote monitoring capabilities at our hospital, so we have cameras. We keep building our supply of cameras. We use them as baby monitors. We use them for patients. Today we have 9 patients that have a poor short-term memory, and they may try to get out of bed, and one person is watching 9 of those people and will say, "Dee, don't get out of bed." And the person gets back in bed. Of course, it requires a lot of education. The person isn't responding to the voiceovers, then we can set an alarm. We're connected with a telephone to alert the staff that the person might be in danger. And we have a lot less falls and a lot less adverse outcomes because of these cameras. We have greatly improved cardiac monitoring systems. And so I just remember, they used to be this little thing that would bleep across and a piece of paper would come out. Now our monitors are highly sophisticated. We can tailor the alarms for the individual people. We have different types of lead placements that can decrease alarm noise. And nurses can carry beepers that go off when there's a problem. So this has greatly improved response times to emergencies as well. And along the same line, the ventilators have a lot of bells and whistles which help us to treat the patient much more safely.
And the Hospital for Special Care, I would imagine, has a higher population of people on ventilators, percentage-wise, than...
We have about 100 ventilators currently that are chronic, and we're the largest ventilator fleet in Connecticut. And hospitals that cannot wean patients off ventilators send them to us, to our weaning unit. And we have a very high success rate.
One shift, certainly in the time I've been receiving medical care, is towards outpatient.
Our neuromuscular clinics have grown to a great degree. We have full schedules in our outpatient autism, neuromuscular clinic, physicians clinics. We do baclofen pump refills for patients that have tremors, and that part of our hospital is experiencing a tremendous amount of growth.
And there's swimming pools and all different facilities, I guess I would say, right?
We have an aqua program that is not only used by the community for health and swimming and swim classes, but we are also able to take our patients in there. So patients with traumatic brain injuries, patients with autism, patients with neuromuscular disorders into the pools for therapy, which is unusual. And then I believe that we're the only facility, LTAC, that has a horse riding stable. So we call our stable Mains and Motions, and we do therapeutic riding for patients who've had stroke or anxiety or need to work on their balance. And a lot of people have benefited from that service.
Children in particular, too, right?
Correct.
As well as people have had injuries or other issues. So I know I've seen kids riding, and there's a helper on each side.
Correct.
Right, keeping it safe, but giving them a sense of really motion and balance.
Correct.
There's a huge fundraiser every year.
Right, our Mains in Motion fundraiser is coming up in October. We all dress like cowboys, and we have silent raffle, and it's really a lot of fun, and I encourage all your viewers to attend.
So that's in Middletown, actually, the barn. Yeah? And in terms of all these advancements in the medical field, how does a hospital, such as the one you're in and yourself, go about helping them get trained and stay trained, all the different roles that they have?
It's definitely a challenge, but well worth the effort.
Mhm.
So all of our education programs are strictly aligned with our strategic plan, our mission, and our vision, and always administrated with our caring value. So we start with onboarding and orientation, and based on the person's role within the facility, they get a specialized orientation, which covers all of the regulatory needs, all of the equipment they're going to use. And we have a formal mentoring program at the hospital, which pairs a nurse with an experienced nurse, a CNA with an experienced CNA, to help enculturate them into the hospital's policies, procedures, culture, all of that.
And also, I would imagine as new technology becomes available, there's a huge learning curve there.
Absolutely. So if I can remember, in the past year, we've had an increase in the number of people using the electronic medical record. So that has taken center stage as we are upgrading and moving toward our new EMR. We're almost completed. The Avashore cameras require a lot of technology education. We have new cribs, we have new equipment that is used on patients, and we have to be sure that the staff is comfortable using that before they use it on patients. So,
One guest that came on had been involved with that skeleton. Is that something that's in use that helps the
it
person
is.
actually move and walk?
Yes, so our exoskeleton is available for people who can't use their extremities. So it holds them in a rigid position and helps them to ambulate while exercising their muscles and tendons in those areas. Helps with circulation and muscle strength.
And there's also some other medical issues that probably many of our viewers have had to deal with in their family or themselves. So things like wound care, isn't that huge? Anyone who's been in any kind of a medical need situation for any period of time really runs the risk of having skin breakdowns.
That's correct. We have a lot of technology associated with wound care these days. We have a cell phone run program which allows us to photograph the wounds and document them, measure them. We do wound rounds on patients. We have different types of vacuum equipment that goes on. So a lot of education is done on that as well. And then for people going home, education is done for their particular need.
And then other things like infections, right, associated with different devices or procedures that are occurring can have a side effect of introducing some infectious or bacterial.
Right? Just walking into the hospital, you're at risk for developing an infection just because of what is there. So we have a very strict hand washing campaign that goes on. All equipment is carefully monitored and patients are monitored very closely for signs and symptoms of infection when they are on these pieces of equipment.
And that's all tracked, and you as the chief nursing officer, you need to be responsible for all that documentation and procedures and making sure people are doing what's necessary to keep themselves and their patients safe.
Correct.
Right.
So in my role, I'm responsible for the provision of care, which not only includes staffing and scheduling, but our quality outcomes. And I work very closely with the director of quality, and we react immediately if there are any upticks in our data. So I'm always looking, how are we doing with our catheter-associated infections, ventilator-associated infections, all the different types of infections that could occur. We're doing very, very well with our outcomes. It is great.
And education plays such a big part in that.
It does.
Yeah. How do you keep yourself informed? You need to be a little ahead of her, right?
Right. So I try to be involved in professional organizations on the local and national level. And I do a lot of reading of professional journals. I've developed relationships with many people in the field, and I've learned a lot from them. The Connecticut Hospital Association is very helpful and proactive in keeping us abreast of the latest trends. So it comes from a lot of sources.
So having to be a real learner in terms of just knowing there's so much you just have to keep up with.
And to be able to be flexible, to change your direction based on, you might think this was a great idea, but your data is showing you it's not that great. Let's try something else, that kind of thing.
And where does teamwork come into play with all of your staff?
Teamwork is probably one of the most important elements in running a good hospital and having excellent outcomes, not only within the nursing team, but within the hospital in general. So traditionally, hospital departments have worked in silos. Like you might be great at finance, and you might be right down to the penny in the budget, but the budget might not be reflective of what you need. So it's very important to reach across those silos, develop relationships, and help each other understand the issues. And so being very flexible, the team can work for each other. For example, when I'm away, I assign a CNO for the day, and one of the nursing managers takes my place, and she goes to the boardroom and she learns how to articulate issues with the other departments, and they take turns, so they know what I'm doing, I know what they're doing, keeping everybody informed.
And our society is increasingly risky in terms of violence and trends associated with that. How has that affected hospital operations and nursing roles?
Hospitals are simply a microcosm of our current society, whatever genre you put in there. And so right now our society is quite violent. And we do a lot of preparation and practice. We do a lot of de-escalation training with our staff. We have frequent classes on what to do if somebody was going to hurt you, how to position yourself. We do a lot of drills. We offer evidence-based programs on safety care, which is all of those things, plus if you have to hold a patient, how to do it safely and how to document it and make sure that you do it right every time.
Do you have cross-training that goes on with your nursing staff? Because I know there's different parts of the hospital that are more, say, long-term, chronic versus more acute issues that need to be monitored in a different way, perhaps.
What we tend to do is we cross-train within the acute units. These units tend to have cardiac monitors. The patients are more unstable. These patients come from hospitals right out of the ICU. So they're pretty fatigued, and many of them are still a bit weary. So these patients require a higher level of care. So we do train, most of our nurses can cross-train, go into any of those units, which helps if we have a sick call, a vacation, a leave of absence. Within the chronic units, we do the same thing. Like their commonalities are most of the patients have feeding tubes and they have ventilators. So those nursing staff are trained on those particular initiatives. And then we have psychiatric units as well. So those staff tend to rotate within those departments with thorough training and preceptors.
And then the CNAs play a role, a big role, I would imagine.
We couldn't run the place without our great CNAs. They've helped us. We're having a focus group next week to get their feedback on how we can make our hospital more efficient and how we can make their job easier to do. It's a highly physical job. How can we help with that? They are the ones that notice early stage pressure ulcers, alert us to them before they become a major problem. So I was a CNA to start. Yeah, absolutely. So there's an ongoing training program. We have a monthly onboarding program for the CNAs. We have an annual competency fair, which they come and just review their skills. You may have learned it but haven't done it in a while, so we're just making sure for safety purposes everyone is up on the same level and feeling confident. Confidence has everything to do with performance, right? So we do have opportunities. We have probably half a dozen CNAs in nursing school now, and we're assisting them through scholarships and through a generous tuition reimbursement program.
Well, let's go back and talk about how you moved from being a CNA, being someone with a PhD and a master's degree in education and nursing, and what interested you in nursing?
I kind of fell into it as kind of a necessity, looking for a job as a teenager. I knew I wanted to go to school. I knew I wanted an after-school job. And I took a position at a local skilled nursing facility. So the school bus would drop me off, and my mother, when she got out of work, would come and get me. So I would maybe work 4 hours. And back then there were no certifications. They trained you on the job. And so I did that for probably 3 or 4 years part-time. And then my mother, who's my greatest supporter, said, I think you should go to nursing school. So I went directly for my bachelor's degree, always coming home in the summer and working back, always having that work element in to be able to tie theory into practice. Every little experience makes the next experience easier to understand and helps you build your knowledge. So I worked as a nurse at Yale New Haven Hospital in the coronary intensive care unit. From there, I went to St. Mary's to their critical care unit, and then was recruited as an educator up in the Sharon Hospital. Just go back, when I worked in the education department at St. Mary's, they gave me the job because I had a lot of excellent clinical experience, but they said you have to get your master's degree. So as frightened as I was to go, I went. I really didn't feel like I was going to do it, like I was going to make it. I had took one course, and I got an A, and that was it. I said, I can do this. Wonderful. And so I went back. It took 6 years, one course at a time, because I was working and going to school and raising my children simultaneously. So that was my one night out a week that I could be with other women who were kind of going under the same situation as I was, just plugging along. And then when I worked at Sharon Hospital, they had a very generous tuition reimbursement program, which allowed me to get my doctorate. I've basically been in school all my life, and except for the past 4 years.
I've heard you describe some of what goes on in your current role with education. It's like you're running a little university.
Correct.
Helping with conferences also that involve people outside the hospital.
Absolutely.
And your community involvement in your own profession and industry.
Correct. So my 2 current initiatives that I'm participating in is the Connecticut Nursing Research Alliance. We're having a conference in October, and that's going to take place at Hartford Hospital. And the topic of that conference is how to bring joy to your work. We get so tired and so run down of the mundane things we do. Let's bring a little joy into our practice. And then sponsored by the Hospital for Special Care is the Marie Gustin Annual Interdisciplinary Conference, which will take place in October in CCSU. And this year's topic is patient and family engagement. We've gone from a paternalistic healthcare environment where the doctor just tells you what to do and you do it, to having patient portals and having them see their lab and their medical record and asking them to ask questions. And so this is a newer philosophy that's happening, patient engagement, where actually reimbursement is going to be better if your patients are more engaged, and their health care will cost less for chronic conditions if they really understand their inhalers and their diets and other aspects of their
condition. Come into play.
Correct. Keep them out of the ER, basically. Yeah.
And you talk about your mom being your greatest role model, supporter, and I believe you were the first in your family to go to college.
That's correct.
Yeah, and so those were big steps that you took with her support.
She was always pushing me to be better and to do more, but not forcing me. I grew up in the 1960s where women didn't have the place in society and have the options that they have now. And her friends, were in difficult positions where they were dependent on their husbands to make a living, and they didn't have a lot of choices. And she would always say, you have to make your own cake. The man you pick is the icing on the cake. The man is not the cake. And so I always kept that in mind as I was going and going to college, and keeping my goals in mind is that this is my cake I'm making. And it really kept me on the correct path. And my mother was always instrumental whenever there was a setback. So, in college, there were very rich kids who would go to Europe for the summer, and I would go to the nursing home, and I would be down about it, or I would have a physics exam and I felt like I was going to fail it. She always was there with kind words, support, fill up my gas tank, go out there, you can do it. And she still does. She's still doing it, and she's 80. But I've also had a lot of other wonderful support systems. My husband and children have always been right there by my side, supporting me and pointing me in the right direction and helping me from getting discouraged with my education.
I just want to invite you to share any advice you give to your younger.
I think maybe at age 25, probably to have more confidence that I really can do what I'm trying to do, and that every little step toward reaching your goal is a step toward reaching your goal. Sometimes you don't see all those building blocks together. And probably to myself when I was 40 is that midlife's going to be all right. Your kids are going to fly the nest. You're going to be able to handle it. They're going to be competent adults. You're going to be proud of them. You're going to miss them, but you're going to get through it.
Wonderful. Thank you so much for sharing your story.
Thank you for having me, Georgianne.
It's been wonderful. And please tune in to your other fascinating women on future segments of Midlife Matters. I'm Georgian Lussier, your host. Thank you for joining us.
And it's my pleasure to do it.